Hello, I'm Dr. Kristen Knowlton of the Department of Therapeutic Radiology at Smilow Cancer Hospital at Yale New Haven Health. The Department of Radiation Oncology at Smilow Cancer Hospital and our care centers is accredited by the Accreditation Program for Excellence, also referred to as APEX. APEX accreditation is administered by the American Society of Radiation Oncology, which is a premier national and international organization dedicated to the field of radiation oncology. APEX accreditation is granted to radiation oncology practices that meet high standards for quality patient care. APEX is considered to be the most comprehensive and rigorous radiation oncology accreditation program. Accreditation is based on a set of evidence-based standards focused on 5 pillars of patient care: the process of care, the radiation oncology team, safety, quality management, and patient-centered care. During the accreditation process, the APEX accreditation team performed a thorough review of our patient care team, systems, policies and procedures, equipment, and our commitment to patient safety and continuous quality improvement. We are very proud to have achieved this distinguished accreditation through APEX that highlights our department's dedication to providing safe and high-quality care to our radiation oncology patients. Take a look.
Radiation Oncology at Smilow Cancer Hospital is dedicated to delivering high-quality, safe, and effective patient-centered care. The safety and welfare of our patients comes from our commitment to high-reliability practices, employee and patient engagement, continuous monitoring, and performance improvement. Our multidisciplinary team of professionals plans the most effective and safest way to deliver treatment based on proven practices and consideration of each patient's needs. We encourage patients and their families to be active participants in decision-making regarding their plan of care. We actively seek feedback and suggestions from patients and from staff to use as opportunities for enhancement of our services. The process of ensuring patient safety starts before you enter our front door.
Our intake consultation process includes the gathering of pertinent information to ensure medical records are complete so that our physicians have the information necessary to provide patients with the most informed recommendation about a proposed plan of care. We are able to provide the most advanced technology selection in our area, all designed to achieve the optimal treatment outcomes for our patients. With any new equipment or upgrade, our teams of medical physicists and engineers evaluate and ensure the safe operation of the equipment before putting it into service. Working with the equipment manufacturer or service company, our team performs extensive acceptance testing and commissioning to ensure readiness for use and continued safe operation of the equipment. All of our linear accelerators undergo daily, weekly, monthly, and annual industry standard quality assurance checks to ensure every patient is treated safely and accurately. In addition to quality and safety checks for the equipment, each patient record is checked and monitored before and throughout the course of radiation therapy treatment by our treatment team of radiation oncologists, medical physicists, nurses, dosimetrists, and radiation therapists. These checks ensure the ongoing treatment delivery is accurate and according to the physician's plan for their course of treatment. When it's time for the consultation appointment, safety checks are performed by the receptionist, who will ask for the patient's name and date of birth, which is then confirmed against their electronic medical record, or EMR, and their patient identification wristband. Before the first consultation, our physicians diligently review the medical records collected at the time we receive the referral. At the consultation, our physicians will complete a detailed evaluation of the patient's condition and will review their plan of care with patient and their family as detailed as possible. In some cases, an outside review of the proposed plan will take place with other oncology specialists at Smilow. This tumor board review is comprised of a multidisciplinary group of medical professionals who review the medical record as well as relevant pathology and imaging received. They discuss the case in great detail to ensure the treatment plan is the most comprehensive, individualized treatment plan. If radiation treatments are recommended, patients will be scheduled for a CT simulation. Our safety checks for this process include a CT assessment before the procedure, which serves to prepare the team for obtaining the specific information requested and planned by their radiation oncologist. These include, but are not limited to, patient positioning and any special considerations, such as pacemaker or other medical device. Once again, we will confirm identification against the ID band, as well as performing a timeout for the procedure, which will include confirmation of the area to be scanned. The time between CT simulation and the start of planned treatment is when our medical dosimetrists and physicists collaborate with the radiation oncologists to create an individualized radiation therapy treatment plan. Each treatment plan undergoes rigorous review and quality assurance checks to validate the plan is consistent with the radiation therapy prescription created by their radiation oncologist, ensures that the radiation therapy plan is of the highest possible quality, and the dose delivery instructions and parameters are accurate within the electronic medical record. These checks begin with the dosimetrists, medical physicists, and radiation oncologists. Once the radiation therapy treatment plan has passed all of these checks, it undergoes a final quality assurance check by the radiation therapists who will be delivering patient treatments on a daily basis. Once the radiation plan is ready, and before it is used to deliver the radiation prescribed, one more quality check will be performed. This process evaluates positioning through image guidance techniques tailored for each individual patient. A final approval from the radiation oncologist is required before we begin the radiation therapy treatments. Although it may seem repetitive, safety is our highest priority, and therefore identification will be verified at each appointment, beginning with the check-in at the front desk and before each radiation therapy treatment. Patient's name and date of birth will be verified against their patient identification band and their electronic medical record, or EMR. Additional safety steps are also taken to verify the patient's identification photo within the radiation oncology medical report, confirm the anatomic location where the radiation treatment is to be administered, and confirmation of the correct treatment parameters. We call this process a timeout. This timeout is not unlike the timeout procedure performed in an operating room and helps us to ensure correct patient, correct procedure, every patient, and every time. Many other quality assurance or QA initiatives take place outside of the consultation, CT simulator, treatment rooms, and clinic. These QA initiatives are in the form of multidisciplinary meetings and huddles, where the team comes together to discuss topics specific to quality and safety. These meetings occur daily, weekly, and monthly to enhance our communication within the team, as well as throughout the institution. Our practice uses a team-based approach led by a quality and safety coordinator that drives continuous improvement around quality, safety, and patient experience priorities. The Quality and Safety Coordinator focuses on implementing safe systems and practices by measuring where we are and how to make things better. Our team is constantly evaluating our practice and processes, which helps us improve how we work and maintains our commitment to patient safety.
At Smilow Cancer Hospital's Department of Radiation Oncology, our priority is your care and safety. We encourage questions and welcome any opportunity to demonstrate our safety procedures.